today I'm going to talk about the Metaneb. First thing that I would do before entering a patient's room, review the patient's chart, see if the patient is alert and oriented, if they are compliant with therapy. I would go ahead and collect any adapting pieces that I would need. I would get the Metaneb machine itself, which looks like this, and I could go ahead and grab the tubing here. This is it'll come with some adapter pieces, but if it was a trach patient, we can go ahead and hook it up to a trach. If it was a mouthpiece, I would need a tight seal anesthesia mask on there, not just a regular aerosol mask, because I need to create a tight seal with the positive pressure that I am giving. And so then any medications that I need, if I need any bronchodilators, Xopenex or albuterol, or if I'm just going to use saline. So then I could go ahead and enter the patient's room, introduce myself. Hi, I'm Kate, I'm with Respiratory. Today the doctor has ordered us to do some lung exercises, and this we're going to use the Metaneb today. It's going to do some lung expansion therapy, also help with secretion clearance, and then also at the same time deliver some bronchodilators and some other medicine that the doctor prescribed. You can do like some mucolytics or something like that as well. So the most important thing to watch with the patient, one is their pressures, their expiratory pressure. Here I'll show you on the device. You want to keep it, we want it to be therapeutic, so we want it to be at least above 15 on our gauge here. We also would like to monitor their seal. So if they're using the mouthpiece here, they need a tight seal around the mouthpiece. If we're using if we're using anesthesia mask, we're going to go ahead and make sure there's a tight seal around there. So we'll go ahead, we can connect our device to Metaneb. I'll show you here how to connect it. The little groove piece just connects in there, and then you'll tilt, locking it into place, you can see. And then we can hook up the machine to the wall. Hook it up there. Perfect. Okay, let's go that way. All right. And then we can go ahead and we'll have to connect this all together, but then you can go ahead and put your medication in there as needed. All right, so we'll instruct the patient to go ahead and hold this and put a tight seal around their mouth, and we will start them off with the aerosol therapy. So you can see here, the on switch is up here on top of the machine. Right here would be the aerosol therapy. I'll start them off at a low flow and then go ahead and adjust as I see fit for my patient. We can go ahead and do 2.5 minutes. This is not making them work as hard. Then we can go ahead and switch it up to the continuous high flow oscillation. We have options here to oscillate faster or a little bit not as fast here. This one, however, it's a stronger pulse, so it does make them work a little bit harder. Then we'll go ahead and do that for 2.5 minutes. So our protocol here at MCR is 2.5 minutes, 2.5 minutes, and then 2.5 minutes on the continuous positive expiratory pressure. This is the same part as the Easy PAP. So again, I can adjust the flow. I'm going to be monitoring the patient's compliance, if they have a tight seal, and if they monitoring their pressure here. It's the most important thing. Contraindications for this machine would be a untreated pneumothorax. If it was treated, if they had chest tubes, we could go ahead and use it. We'll also be watching our contraindications, any facial trauma, bloody nose, throwing up blood. Also, if we have, we're going to be watching for any ICP greater than 15. This will make you a little bit lightheaded, and it's quite a bit of work. And so we'll be watching our patients for that as well, giving them breaks in between if needed. Like I said, you can use this with a trach, a mask. It can't be an aerosol mask. It needs to be a anesthesia mask, and the reason for that is it needs a tight seal. If you're using an aerosol mask, it has holes in it. You're not going to get any positive. The positive pressure is just going to leak through those holes. So it needs to be just a tight seal around the mouth, and then or the mouthpiece. So I'll go ahead and run through this with you, and you can see what it looks like. I'll turn the machine on. Let's see, we'll start on aerosol and a low flow, and we'll go ahead and start it. Then we'll go ahead and turn up the flow. You can see, you can hear it, it's a lot louder, flow going. And then watch my pressure here if you can see it. Now I'll go to the continuous high flow oscillation. Then we'll go ahead and go to the continuous positive expiratory pressure. After treatment, I'll make sure to listen to their breath sounds, monitor the patient's work of breathing, and go ahead and make sure that they're comfortable and they need anything. That's it.